Hi, everyone. My name is Jerry Lin. I'm one of the product managers for Google Health, and I'm really grateful for the opportunity to be here with you and give you a brief overview and just engage with you in terms of the direction of Google Health. This is what I wanted to cover, just kind of give you a background. I also wanted to transition into a brief demonstration of the product, largely because I think that it makes it a lot easier to visualize and understand the product if you are able to see it. Talk about some of the research challenges, particularly around the UI and usability, and then close with some question and answers. So a lot of times people wonder, why Google and why health? One thing that people may not know about is that Google today answers more health-related questions than any other source on the planet. And so you wonder, are we able to do a better job if we allow users to store their information? We think so. Also, if you think about Google's mission and being able to help organize the world's information and to make it useful, health information is clearly very important, and it's still at the stage where it's also very much offline. And of course, it's within Google's DNA to try and embrace big challenges, and clearly healthcare in the United States is such a big challenge. So if you put all that together, Google's health mission is to help users organize and store their health information and to connect them to relevant services that can work for them. If we look at the current landscape of healthcare today, this is kind of my biased view. You have the patient off on the side, and you really have the doctor in the center. And to just kind of illustrate this point, I'll give you two personal examples. One was when I moved from Philadelphia back out to California, I wanted to get my son's medical records. And it took a $25 check and it took 2 months in order to get that record to transfer. Prior to that, we didn't have a copy of his medical record in our hands. The second example is my wife, when she was pregnant, she had some pregnancy-related complications and had some lab tests done. When she was talking with the doctor's office about this, the doctor said, "Oh, don't worry, we'll call you if anything is abnormal." And so you really see that the doctor in the doctor's office is at the center of all that information flow, and then the patient is off on the side. And in the past several years, people have been talking about consumer engagement, and we really wonder, well, why isn't the consumer engaged? Well, maybe it's because the information really isn't flowing to the consumer, and the consumer's off to the side. So the vision that Google Health has is to really put users in the center of their information flow. Information can come in through one of many different sources, whether that be a biometric device like a blood pressure cuff, or whether that be through labs, through hospital information systems, through pharmacies, maybe through insurance companies. A big part of Google Health is to connect users to these information sources so that they can more easily aggregate copies of that information into one place. Of course, the question comes, well, if that information is all in one place, how is that going to be useful? Clearly, if the person ends up in the emergency room, having that information readily available will be very useful, but what more could be done about that? And so that's why we've really opened up the Google Health platform to what we call third-party services. The idea is that someone who's or maybe in the medical field already, or maybe not, they can come and bring their expertise to users to help them make sense of their information. Maybe there's an electronic medication organizer that reads in my list of medications and displays in a calendar view that I can print out and put next to my medication cabinet. Maybe on top of that, it can even send me an SMS reminder every lunch, saying you should take the blue pill, the green pill, and the yellow pill, and just help me with compliance. Or another idea is just immunization dashboard. I have a 22-year-old son, and I've taken him for a lot of immunizations. Gee, I'm not sure what. It'd be great if I could set up a health profile for him. The service can read it in, per my permission, and can display the shots that he's had against the CDC guidelines and tell me, you're up to date on these vaccines, but you need to get these done pretty soon. That would be pretty useful, and that would be an example of how other people can bring their expertise to help users manage their health information. Just to give you a little background of healthcare in America, I think these are all things that you intuitively know. these are just some interesting statistics that I found. One, we see that there's pretty high turnover among patients with their health insurance companies. Two, a lot of lab tests are being repeated. Three, especially as the patient sees multiple doctors, even if he has a primary care doctor, he may see specialists. But even under the PPO model, there isn't necessarily a primary care doctor. So there are issues with coordinated care. And Americans are actually asking for access to their online records. And they think that they would be able to get better quality of care because of that. So with that, I would like to just go and transition to doing a demonstration of the project. So you can take a look and see what it is, hopefully a little bit less abstract. If you go to google.com/health today, this is what you'll see. This is the sign-in page. We have a very familiar sign-in box so you can use your Gmail account, your calendar account, or you can create a new account if you'd like. I'll go ahead and log in here. And upon logging in, I'll be taken to what we call the Google Health homepage. So this is the Google Health homepage. On the left here, there are different areas, different links to help people navigate different areas of their profiles. And if they want to see a list of medications, they can do that, conditions, and so forth. You can actually create multiple profiles. Maybe I want to keep track of the health records for myself, but also one for each of my children, and I can go ahead and create multiple profiles. As information gets added to the profile summary will get filled out. And I'll just go ahead and show you what that looks like. Let's say, for example, that I'm suffering from hypertension, high blood pressure. You can see that when I added that information, it shows up here in the profile summary. For those people who are just kind of learning about certain conditions, we offer what we call the reference page. This is feedback that we got from our advisory council. Just kind of give people some grounding. On the left, there's some licensed content to help people kind of just learn more about it. But on the right, what we do is we aggregate queries from a number of different Google properties, including trends, also Google Groups, Google News, Scholar, and just basically give users a starting point where they can go and learn more about this condition. Going back to the application, let's say that I also want to keep track of the medication that I was prescribed. I can go ahead and do that. So obviously this is pretty high level information. Users can go and drill down. They can specify the details of their prescription. And maybe it's been the case that I've been taking Monopro for a long time now. So I can go ahead and indicate that, and those pieces of information get stored. Obviously, we don't expect that users are going to be very thrilled about typing in their medical history, piecemeal like this. So we've been really working hard on this directory to allow users to more easily import copies of their information. So today, if you have an online account with one of these 8 institutions, you can go ahead and ask them to send you an electronic copy of the details that they have regarding your account. And to show you what that would look like, I'll go ahead and walk you through the integration process through Beth Israel Deaconess, which is a hospital system in Boston. I'll go ahead and sign in with my Beth Israel username and password. And then I want to establish a link between my Beth Israel account and my Google Health account. And this just walks me through that process. Now, at this point, I'm back at Google Health, and Google is asking me, hey, Beth Israel wants to send you information. Are you OK with that? Information does not flow in, information does not flow out of the user record without the user consenting on both sides. So yes, I want a copy of my information. And so Google will allow that connection to be made. Now that the link has been established, I can instruct Beth Israel to send me a copy of information. They've given me a choice. Maybe I don't want to send all the information. In this case, I do. So I'll go ahead and ask for all that information to be sent over. In just a matter of seconds, Beth Israel will tell me this information has been sent. That's great. What does that look like? Let's go back to Google Health. And you can see now that the link has already occurred. In addition, Beth Israel has provided some shortcuts. If I want to make an online appointment using their system, if I want to email a doctor, I can go ahead and click on these, and it will take me back to their system. So when I do a refresh, you can see that this information has indeed arrived. And I can go ahead and click on my list of conditions, and I can see the information that is derived from Beth Israel versus the information that I've entered. So we keep attribution because that may be important later on when the data gets interpreted. Now, some of you may have realized that there was a red flag that's being raised under drug interactions, and I can go ahead and click on that. And this is basically Google saying, gee, from what we know, you said that you've been feeling faint and that you're also taking monopril. From what we know, that doesn't seem like a really good combination. You should probably follow up with your doctor on that. So this is an example of one of the benefits of having all of your medical records in one place. The doctor that prescribed monopril may not have been aware that you had a condition of feeling faint. And so as you aggregate kind of the different copies, you can check for drug-to-drug interactions, drug-to-allergy interactions, or drug-to-conditions. And in this case, I might be like, oh, actually, I took monopril many years ago, and actually I stopped taking it a few years back. And just to kind of show you that this is all structured data format, and you can see that the red flag has disappeared because I've indicated I'm no longer taking it. Okay, great. So we've seen how information comes in. Now, what can you do with this information? Well, let's take a look at what we call third-party services. At launch, there were 14 of them. And the idea behind here is just, each of these third-party services will offer some interesting piece of functionality based off of the data that's in your profile. So I'll go ahead and link to ePillbox. ePillbox is an electronic medication organizer. Usually I would sign up for an account if I haven't already done so, but since I've already done that, I'll go and do this. So again, I'm taking back to Google's site, and Google's asking, hey, ePillbox wants to read your information. Are you okay with that? Yes, I want to take advantage of the service. I'll go ahead and do that. And you can see that this information has come over. So I can click on this, and I can see that this gets displayed in a calendar view. But what's really nice about this, in addition to being able to specify my preferences, like, oh, actually, I want to do it in the afternoon, or I want to take all my pills at once, I can even give my cell phone number, and it can send me an SMS reminder. So this is a really good example of functionality that we may not be building, but we would really love for other people to provide the service to users. And the business model is really up to them. It can be free, if they just want to develop their brand. It can be, if they want to have advertising supported, they can do that. If they just feel like their content is really good, their service is really good, and people are willing to pay for that, it's up to them as well. We don't arbitrate among that. We just really emphasize transparency, and we want the market to decide which services should get used. Oops. So let me go back to Google Health site. So that is basically the demo. Information can come in, information can go out, and can be acted upon. And you can see how, as we work on this link, hopefully there will be more and more connections, and hopefully the pharmacy that you go to or the insurance company that you're a member of, would be connected so that you can get copies of information. So with that, I'll go ahead and switch back to the presentation and talk about some of the research challenges that we've had. It's really unfortunate that I guess that all the people who were interested in HDI left, because that's actually the bulk of the challenges that we've been experiencing so far. It was just, really hard issues around usability. So these are some of the topics that I think are probably worth mentioning. How do you support granular sharing? How much should you emphasize privacy? If you get data from about the same events from multiple sources, how do you help the user visualize that? And, in a question about security. So I'll go ahead and start with the granular sharing one. So if I have all my information in one place, who thinks it's a good idea that I should be able to share it with people that I want, whether that be a spouse or whether that be a doctor? Let's just do a show of hands. Okay, it's not a trick question. I think that's very useful. Okay, great. So now let's do a little bit more granular. Who thinks that I should be able to share a list of medications, but if I want to share my conditions, who thinks that I should have that ability? Okay, so a little bit more granular. How about let's just look within the list of conditions. Who thinks I should be able to share that I have arrhythmia, but not that I have cancer or AIDS? Like, who thinks I should be able to do that? All right, so yeah, so I have the ability to share one, but not the other. Yeah, okay, great. So we all think that granular sharing is a great idea, additional functionality. We want to support that. So if I were to tell you that Microsoft currently allows granular sharing, but Google Health does not, you might think, oh, that's one area where they lead. And so this is an example of their UI, right? Who thinks that this is going to be extremely understandable and usable? Like if I wanted to share one condition but not another, like how many people are going to understand this and kind of really be able to take advantage of that feature? Just give me an example. Let's say that I have blood glucose as measurement. And let's say that I've checked it under, yes, I want others to be able to see that, but not under my diabetic profile. Well, obviously, blood glucose is pretty important in terms of diabetes. So if I have one check but not the other, should that information get shared? Clearly, this is a problem that we haven't solved. We think that Microsoft probably hasn't solved it either. But this is certainly a very real UI challenge, right? Like, do you really want to implement ACLs? Like my doctor can see everything, my spouse can see most things, my kids can see some things, and it's just like how do you implement that in the UI so that it's still usable? This is in a previous iteration before we launched. We gave users different options. You can specify which profile you want to link to, and underneath that you can specify different levels of access privileges. And then the information that you get from that source, do you want to make that private or public to others? We implemented this, we tested it out, and it was tough. Like the usability tests, people kind of got some of it, but not all of it. And so we were worried, like especially with all these privacy concerns, maybe people would accidentally share information that they didn't want to. So that's why this is an example of functionality that we actually took out when we launched. We just made it really simple. My pharmacy is going to be able to send information to you, or my pharmacy is requesting permission to read information from your account, and we'll be able to read everything. Obviously, granular sharing is something that we want to support. Clearly, just as evidenced by this audience, we all think it's very important. But how do we get it right? How do we do it in such a way that users understand what they're doing and they won't accidentally release that information? So this is a very acute user interface problem for us. Another problem, of course, revolves around privacy. So many of you are probably familiar with a New York Times article that cited the study among college students. The finding here was that if you mention the privacy issue, even if you give very, very strong privacy guarantees, people are less likely to share information. Versus if you just take a very cavalier attitude, if you give them no reassurances, they're much more likely to share information, including that they tried cocaine. So, privacy is obviously a very important issue for health. We do worry about user perceptions and things like that. And there may be some in the audience who are thinking, well, we should do full transparency, make it extremely prominent. And if it's the case that people clam up and don't share, then so be it. But we start with the premise that Google Health is actually offering a very useful service. And we think that we would be doing a disservice if we were to cause people to shy away from usage of it. So kind of given those two premises, like how do we start, how much should we emphasize privacy? If you go to the sign-in page, there's actually, the privacy policy is linked to 3 times. Twice here, and then there's once in the footer. This probably breaks some UI rule about having only one link to one place. But in this case, when we launched, we thought, well, we do want to make sure that it's readily available, people can find it very easily. And so unlike other products, we've actually put a link right underneath the sign-in box so that it can be seen. But what should we do about this? Should we, some may even be able to might say, you should put the privacy policy on this page, or put it in a box, or maybe you should kind of highlight more principles. Not sure. Another area with the privacy policy is what should we do about when information is being shared with third-party services? So you saw the screen where it says my pharmacy or whoever is asking for permission to read or write. Should we put that organization's privacy policy here? Right? Again, that would be transparent, but the mere fact of just putting it on there, even if HXTI in this case has extremely strong, extremely user-friendly privacy policies, and says, you can have your own key and no one else can, get this data unless you supply the key, just the mere fact of mentioning it may drive people to use it less. And we think that there may be some useful services that are out there. And how do we reconcile that?
Do you know statistics as to how many people actually read the privacy policy among the users? Have you tracked that?
We do track that. We do. But nevertheless, a lot of times, a lot of the feedback that we do get from our help center and stuff is like, is this, how secure is this? Who can see this information? So privacy is on the minds of people. And how do you address that?
So one of the issues around privacy is inferred data. So you said earlier, do you think people ought to be allowed to list their conditions but not their medications, or their medication not their conditions? But if you give me a list of your medications, probably even using Google, I can very quickly find out what your likely condition is.
Absolutely, and so that's a concern, right? And so isn't that just another way where we can mess up, where users might share some information thinking that they're sharing a limited subset, but in actuality, they're sharing much more than they realize.
But how quickly, do you have a feel for how quickly that gets out of hand?
Well, that's an issue that we're looking at and we're thinking about, and we want to be very thoughtful when we roll out, sharing. And when we roll it out for the first time, we're probably not going to have the right answer. I'm going to move on. And
question, these third parties, do they give you any structured information about their privacy policies, or is it all just language policies?
so yeah, sorry, thank you. So the question was, what about these third-party services? Do they give you structured information about their privacy policy? And so currently, we don't do that. In part because there can be so many variations on that, so that it's probably most easily understood in English rather than as structured data. But I mean, that's certainly an area that we could explore and think about improving. So another UI challenge is, how do you visualize data from multiple sources about the same event? If the doctor prescribes me something, if I go pick it up from a pharmacy, if I record that, I take that, and if I go back to the pharmacy and then I get it refilled, how do I see that data? This is how we currently solve it. I think it's a reasonable first stab. Clearly, there's room for improvement. In the top two rows, you can see that one was user entered and one was from another data source. And then the bottom four rows, you can see how refills are treated. A reasonable first stab, but obviously room for improvement. Security. Some people are worried about, like, well, what if you only have username and password? Is that sufficient? And certainly a lot of people have fallen prey to phishing scams. So how do we address that in a usable way, right? So you can offer a second password, but if they got their first password phished, what's preventing their second password from being phished? Do you want to restrict to certain IP addresses? You register ahead of time. Well, what if I'm on vacation and I end up in the emergency room? Wouldn't it be useful at that time to have access to my data? What about having some physical device I have to plug in, and and then that gives me access to this information? Maybe. Is that really usable?
One technique which is now commonly used for SSH is that you have a private key on a device, because most people, like here, typically have a small number of mobile or semi-mobile devices they use. Have you considered that option? It's kind of in between a dongle and just a password.
Yeah, so that's great. I can have a certificate on my computer. So what happens if I'm out at the movies and I end up in the emergency room?
Right off my
Exactly, right? So the answers aren't clear when we're thinking about it, and when we really love feedback, and different ideas like that. So I spent most of my time talking about UI challenges, but there are also challenges with the data. Data that we receive it all has to be structured, but it could come in as uncoded text, it could come in as coded text, and it could also come in as coded, or it can come in as text with codes accompanying it. So what if someone sends us a text and code that that don't match, right? And it could be very well that because a lot of these codes are used for billing purposes, the doctor just put something that was in a reasonable ballpark, but the text actually was what he meant. But then, what do we show to the user in this case? I mean, do we show kind of our interpretation of that code along with the text, or or when we share this information out, like what do we do? You can also send in codes. So for example, you can send in different codes from different coding systems. And so what if people send us one code from one system that indicates arrhythmia and one code from a different system that indicates feeling faint or something like that? Again, what do you do in that case? And a lot of times when we were talking with researchers, a lot of them, there's a lot of excitement about there could be a really great public health implications to this, and just kind of thinking about how do you efficiently find relationships within the data that are meaningful and that would be useful. That would be another area. Currently, one of our problems is kind of a sales problem in a sense, or a network effects problem. We've kind of sold 10 phones, right? How do we sell the next 100 phones? Once we sell 100,000 phones, it'll be pretty easy to sell the 100 after that. But currently, just having only 10, how do we convince people, institutions, that it's useful for you and for your patients to be able to get a copy of their information? And so that's also one of our data challenges. So with that, I think that gives you a brief overview of health and some of the challenges. Really want to open up some time for questions and answers. And since all of you guys are really smart faculty members, and I'm learning.
A microphone in the middle if folks have access to it, but I'll also come around.
Since I'm learning, I'd really like this to be, I get asked a question, you can tell me the answer. So, please go ahead.
I've got many questions. I come from a jurisdiction different from the United States. It's always a kind of challenge in many things that we hear from Google here because it's US-centric, although Google says they want to organize the world's information, not the United States information. So with that as a preface, and there are a couple of things that you should be doing is looking at other jurisdictions. Canada is way ahead of you.
Yeah.
Right? But they're ahead because of the institutional organization of health. And most Canadians would say it's not your business to make derivative answers when you ask the question about machine learning and public health data. That doesn't mean it's not a good idea to be people-centric in managing it. But I don't want Google in the United States managing my health records, or anybody in the United States for that matter.
So
how do you manage how you learn from other jurisdictions? Because there's two problems there. The second one you can think about is most physicians aren't going to trust this data if me, a standard person, delivers it to him somehow. There needs to be a kind of a focus on building trust.
Right. I think those are two very good points, and obviously areas for learning. On the first one, just keep in mind that this is all under user control. So, even if we come out with a very, very useful application, you can get copies of your medical information from all over. Some people are going to be like, no, I just don't want that information all in one place. That's fine. We don't automatically get that. Information does not flow in unless there's user consent. On the second issue, obviously as we look into other jurisdictions, and we do want to internationalize. I think there may be some implications, and part of those ramifications are why it's taking some time to internationalize, because we have to figure out the legal framework and legal arena. In terms of the second question, we do treat attribution very carefully. We do want to keep, this information came from Walgreens or Cleveland Clinic versus this information is user entered. And obviously, if the user were to take a printout, the doctor may or may not trust that, not sure. But hopefully there will become time where information can flow more easily across interoperability barriers, and the physician can see in his or her electronic medical record, oh, this is a structured data that came in, and this is a way that makes sense to me, and I can see who this is from, and maybe that'll be helpful. I mean, certainly, even if all this information were just treated as user entered, that's got to be better than right now, when a patient goes in, oh, I take this green pill, it looks like this, things like that. I mean, this is a lot more precise information, and we're very much in the launch early, iterate often phase where this is very early on, and we have a lot of room to grow in.
Have you actually had any physician look at this?
So, Cleveland Clinic is working on importing this information so that if you're a Cleveland Clinic patient and you see the doctor, then you can see that. And clearly there are some attribution issues that kind of need to be thought through, and we're working through that. Yes?
I have two questions, comments. One is, you didn't mention really data interchange issues. I'm a networking person, so I deal with protocols. And so I'm curious, is there sufficient standardization of the kind of protocols that allow a variety of health systems, which traditionally I think have every large hospital has, particularly large university hospital, has built their own system, which is completely and utterly incompatible with the next one over, in the US at least. And they built many over the years. I mean, Columbia Presbyterian being a prime example of that.
Right. Right. So clearly there hasn't been an interoperable standard that has been widely adopted by the market. Right. I mean, there's still standards are emerging and are getting adopted by the market, and we see movement in things like Certification Commission for Health IT. That is encouraging the market to go in that way. But clearly, we're not in a place like other countries where information, any doctor can just kind of hop onto a system and see that information. We'd love to be there. We're not there yet.
The second comment is what I've read about electronic medical records has been that one of the, particularly because of the US, very distributed and very small scale, typically individual doctors, small offices type of thing, that one of the bigger challenges is actually not patient access, but that if you look at most doctors' offices, their information technology hasn't changed since the 1970s. The computer often looks like it hasn't changed since the 1970s. And so I wonder if a combination with Google Apps and this wouldn't be much more productive in the sense of actually solving the largest problem of US health, which is the unsustainable cost structure. And that doctors' offices, from what I hear, look at $100,000, $200,000 bills, which nobody's willing to pay for them because they have to build their own hardware infrastructure as opposed to go to kind of a more shared data in the cloud model. Is that something, this may be getting in sensitive areas, but this seems to be, from what I would see in a global perspective, much more productive than worrying about people getting access to their prescription, as useful as it is.
So that's a question that we get often. I would say that Google is more of a consumer-facing company. We don't really have a lot of expertise in kind of building systems for doctors, for example. But I think that you are starting to see market vendors move in that direction of more ASP-based, and I think that really makes sense.
So it looks like a lot of the early features in Google Health, using Google's machine learning techniques and other things, are doing functions that are commonly reserved for expert systems that are backed by tons of insurance, so like diagnoses and drug interactions. Have you guys thought about any of the liability issues? For example, if Google gets really good at detecting drug interactions and then for some reason it fails to detect a drug interaction, then maybe Google's exposed to some liability there, or vice versa. Have you guys thought at all about those types of questions?
Yeah, the question of liability has come up before. And in particular, what drug interactions database do you want to use, for example, right? Clearly, room for improvement here. We think that the posture that we want to take on eventually is that Google is not going to be developing the rules itself because it doesn't have the clinical expertise to do that, but would much rather partner or let third-party services provide that type of knowledge. So we're kind of focusing on building this ecosystem, and hopefully that, there will be enough players to provide that type of functionality so that users can kind of subscribe to the ones that they want, and that would be useful. But currently, we're not there yet.
So quick comment before the next question is that I've also thrown up on the screen questions that were posted on Moderator. Jerry, you've touched on quite a few of these already, but feel free to answer, for example, the first and last question pertains to health. Great.
Well, I think since he's been standing for a while, I'll let him ask this question, and then we'll move on to the Monitor.
All right. So I have actually one sort of recommendation for you, and then one question. So recommendation I would say is that at the beginning you talked about the doctor's way of thinking about about hospitals and clinics, and then the sort of the user in the middle. I would say that one prominent hospital where the whole concept of having patient in the middle, which has been popular for almost 100 years now, is the Mayo Clinic Foundation, Mayo Clinic. So if there's one hospital and the set of doctors you want to talk to, they're the ones. Okay, so that's just a recommendation. The second is that you gave a lot of UI challenges. The one thing I was curious that you did not have there was that the patient population, or the segment of the population that is likely to benefit from this, is all 60 or 65 plus. For that age group, in fact, one of the clear UI challenges here was that you should probably have had a single sign-on because you had to sign on so many times, right? So that itself was not there. But just the fact of getting all the information, getting this whole thing set up, is going to be a big challenge. And in fact, in observing user interfaces for many years, I think the only product or organization I've seen which has successfully brought a whole bunch of people in their 60s and 70s into the sort of the video game age is Nintendo Wii. And no one else has done it successfully yet.
Thanks for those thoughts. I'm going to take a couple questions from the moderator. In the context of Google Health, Google appears to be focusing on electronic medical records. Privacy and confidentiality issues and ethical issues are especially critical in this context. How is Google handling these in the context of Google Health? So in our model, we really want to put users in control, and we want they dictate who can send information in and who can see that information. So we hope that users can understand that control, and hopefully, and we're working hard on making it usable in terms of they're not accidentally sharing information. The second one is how does Google plan and decide to invest for large-scale projects such as Google Health? What are general determining factors, and what are the timeframes for these projects? On this question, I'll involve Alfred, since he's ranking executive here, but I would say that we clearly understand that this is going to be like a very long-term project. Very long, we have to be in this for the long haul. In general, we want to look at what is going to be useful to users that are out there, and the metric that we track is how much is the product actually being used. So that's really a criteria that we look at to judge the success of the product. Alfred, is there anything that you want to add to that?
No, I think. Am I live now? Am I live? Testing?
Great. You want to try this?
There, we got it now. Okay. So yeah, I think the issue is is it in our mission? Okay. So we really do believe. I mean, how many talks have mentioned Google's mission? So that's probably first and foremost in our mind. And second, can we be effective at it? And three, given the degree to which empiricism rules this company, can we prove we're effective at it? And we start small, as you can see. I mean, I don't think there's a ton of work behind the interface you see, but you can see, way more than a ton of things we haven't done.
Yeah.
So we try to start small, and we try to be actually kind of humble in a project like this, and we'll grow over time based on usage. And we think it's such an overwhelmingly valuable program. I wanted to make one other comment. I know we're pretty much out of time, so I realize I'm using up some of your time. We'll take the last question no matter what. But I'm on a National Academy study on how to involve the computer science community in medical informatics. And we could do, Jerry and I could stand up here for 8 hours and do just open technical problems in this domain, just as Jeff Dean did a high-level view across the broader field of systems and AI and what have you. There are so many fascinating and important challenges. There is a movement of money at the NIH into more information technology realm. In fact, remember, the NIH is a $30 billion enterprise. So only 1% movement of money is real money, unlike, say, in NSF, where it's a much, much smaller enterprise in computer science. So I think there's a huge amount of stuff that can be done. They're just tremendously interesting problems, not for consultants. So again, I'm a little bit with Rob Pike on this. If all we want to do is find the technical nugget that we can publish in the classic computer science literature, the medical community and informaticians and Googlers will go solve this ourselves the best we can. But if you want to partner with the medical informatics and physician communities, there's just a plethora of fascinating problems. And it's one thing, you just say, would you access control? Of course, you saw Jerry's comment on that. Of course you want fine-grained access control. And then you realize the extent to which the public will probably not be able to handle that. I mean, and we don't say that as a paternalistic organization. It's just we've measured it, and it's sort of patently obvious that my 92-year-old mother would never get that right, let alone almost anybody else in the world. Anyway, let's get one last question for Jared here.
CMU has a NSF-founded engineering research center on quality of life technologies, and I think Google with this program should be part of that. One of the important goals is, for example, extending the independence of elderly persons so that they go to nursing homes later. Every year they spend at home versus moving to nursing home clearly is very beneficial and cost effective. One effective technique that we are using is defining, clearly we are defining research goals, but nevertheless, clinicians are pretty tightly coupled in that loop. So we get their feedback, opinions before we proceed with specific topics. Not only at the level of defining the research topics, but also we use testimonies from the real users after they try our methods, our prototypes that we built. So there is a lot of that has been going on in that center. It's already 2 years in existence. Hopefully it should be 5 + 5 years. But I'm looking forward to establishing some communication between us and Google.
Terrific, yeah. I mean, we are very much in a learning mode, and we would welcome feedback in all areas, not just HI challenges, but in all areas. And we don't necessarily respond to all feedback immediately, but you may see product improvements over the course of 3 or 6 months that address that. Thank you all very much for the opportunity to be here. Enjoyed the time.